Welcome back. You're watching Newslink here on ENCA. I'm Annika Larson. Well, the World Health Organization wants countries to clamp down on e-cigarettes, saying vaping threatens the global program fighting tobacco use. The organization says children who use e-cigarettes are twice as likely to become regular tobacco users. So with around 1 million e-cigarette users, where does South Africa stand? Vaping remains unregulated, and the Control of Tobacco and Electronic Delivery Systems Bill, which was approved by Cabinet in 2018, is yet to be passed into law. Let's talk to Dr. Catherine Egbe, specialist scientist at the South African Medical Research Council's Alcohol, Tobacco and Other Drugs Research Unit. Doctor, thank you for joining us. In the UK, the government's health research arm, Public Health England, has done extensive studies into vaping from 2014, and their finding is that vaping is 95% less harmful than smoking cigarettes.
Thank you, Annika, for inviting me. I think that we need to set the record straight when it comes to that claim of 95% safety. It was born out of a study that was not conducted in a lab. It may surprise you to know that that 95% safety claim was not even, the study wasn't even done by the Public Health England. They only quoted a paper published by a guy named Knott and colleagues, and it was based on the impression or the decision by a group of scientists. They never conducted any lab studies to make that claim. And if you look at the method they used, they called it the multi-criteria decision analysis. It was not based on any study done in the lab. And if you look at the criteria, there were 14 criteria that they used, some of which had nothing to do with the harm that we talk about, that we see in studies that have actually done lab work. So it's quite unfortunate that this statement is being used so widely without understanding that it was done, outside the lab. I call it mischievous science at best.
Doctor, is there any proof that vaping or any electronic cigarette device can actually help people quit smoking?
So what we found is that at population level, we've not found that. We've not found any proof. And I would say, using data collected in South Africa in a study that was conducted in 2018 with over 18,000 participants, we found that within 1 month to 6 months, those who used, established smokers who used vapes or electronic cigarettes, as I would prefer to name them, we found that what happened was that they were quitting, but then when you look at the long term, that is between 6 months and 12 months, they tend to relapse more than those who do not use vapes. And then if you look at those who tend to go back to smoking cigarettes, there were more electronic cigarette users. And then we also found that more people who use electronic cigarettes were using other evidence-based cessation aids at the same time. So it could mean that even the 1 month to 6 months evidence that we're seeing that it may be helping some people within that range, it may be as a result of some of the other cessation aids that we're using. So we cannot really say that electronic cigarettes are actually helping people quit, because studies conducted outside South Africa has also proven that it rather depresses quitting. And within South Africa, the same thing we found in a study we published this year.
Doctor, let's get a hypothetical X-ray up in front of us. We'll put one who's been vaping for 5 years, a picture of their lungs, and one who's been smoking for 5 years. What do the pictures look like? How different are the lungs of an electronic smoker and a tobacco smoker?
Okay, so Annika, that would be a very interesting study to be conducted. I haven't conducted that study, so I won't be able to tell you upfront that this is what will happen to the lungs of the electronic cigarette smoker. But what we know is that electronic cigarettes actually cause harms to the smoker. It actually affects them to some extent. Some of the things you find in electronic cigarettes you don't find in regular cigarettes. For example, there's a study that has been published that shows that even the storage of the e-liquid in the e-cigarette will lead to the release of heavy metals. So even when they're just stored without puffing, and when they are puffed, they increase significantly the amount of heavy metals that are released into the product. So we don't have that kind of a problem with regular cigarettes. We also do not have the problem of electronic cigarettes exploding like you see in electronic cigarettes. We don't find it in traditional cigarettes where they explode. We don't find children dying from nicotine poisoning because of handling regular cigarettes. We find that in electronic cigarettes. So I would say that while we do not want to claim that electronic cigarettes have the same level of harm, but we cannot say that they are categorically 95% safer. They are not safer in that regard.
Interesting topic. I think we could unpack it for several hours. Thank you so much, Dr. Catherine Egbe, Specialist Scientist at the South African Medical Research Council.